Hi, and welcome to the How to Stop Panic Attacks Masterclass, a complete guide, and what your doctor probably won't tell you. Now, if you've ever had a panic attack, you know there's no just calm down about it. The terror is real, and the physical symptoms are overwhelming a lot of times. So, this makes the fear of the next attack to be a lot of times even worse than the attacks themselves. And if you if you have experienced panic attacks before, you already know the usual advice. You've been told to breathe, to think positive, that it's all in your head, but a lot of people, including most doctors, aren't going to tell you what I'm about to tell you here, and that's mostly because a lot of people don't really know this information for some reason. So, in the next hour or so, give or take, I'm going to show you what panic attacks really are, why they happen, and most importantly, how to stop them completely. Not just manage them, but actually resolve them. I am Claudiu Manea. I'm a licensed psychologist and psychotherapist. I have over 10 years of experience specializing in treating anxiety and panic disorders. I have helped over 1,000 clients overcome panic attacks, and I have experienced them myself for quite a long time in during my life. So I know what it's like to have them, both from a clinical and a personal point of view. So what I'm about to share isn't your typical advice. It's a three-dimensional approach that addresses the physical, psychological, and the spiritual roots of panic, which is why my method works when others simply fail. And by the end of this masterclass, you will understand exactly what's happening in your body during a panic attack, what your panic is trying to tell you, and the specific steps to take both during an attack and after you experience one to prevent future ones from happening. So this is going to be comprehensive. Maybe you should grab something to take notes. And if you find this helpful, of course, please subscribe, hit the notification bell, and also uh, be sure to share this to your network so it reaches as many people as possible and so that it can help as many people as possible. I post weekly on subjects like anxiety, relationships, and personal transformation, so you might want to subscribe just to get notified whenever I post something new. With that being said, let's to start with, let's talk about what panic attacks really are. Now, a panic attack is a sudden and overwhelming episode of intense fear that gets that triggers severe physical reactions, and it does so often with no apparent external cause. Now, a panic attack can have many symptoms, among which are racing heart, the feeling like that you cannot breathe, chest pains, dizziness, numbness, the fear of dying, the fear of losing control, and so on. Most panic attacks peak within 10 minutes and subside completely within 20 to about 30 minutes. The key thing to understand about them is that they feel like you're dying, but you're not, because no one has ever died from a panic attack itself. Now, there's a distinction to be made between panic attacks and panic disorder. And having a single attack can happen to anyone under extreme stress. However, having recurrent attacks, having a persistent fear of future attacks, and having behavioral changes makes it into a panic disorder. So if you behavior changes, for instance, if you start avoiding certain situations because of the panic attacks, then you more than likely have a panic disorder. About 11% of adults experience at least one panic attack each year, and 2 to 3% develop a panic disorder. And women are twice as likely to be affected. There's also a distinction to be made between expected and unexpected attacks. Now, the expected attacks are cued. They are triggered by certain situations that you can predict, like finding yourself a, in a at uh, a place where you are at a great height in an office building or at the top of a mountain of some sort, or being in a crowd, or preparing to speak in public. However, there are those panic attacks that are unexpected, and these seem to come out of nowhere. And they seem to happen when the situation that you are in poses no immediate danger to you. For instance, you're sitting at home watching the TV, you are driving, you are sleeping or preparing to go to sleep. These unexpected attacks are a lot of times more frightening because they feel random. So if you know that you hate speaking in public and you're about to go do just that and you have a panic attack, it's not much of a surprise because you already know that it has happened before, so it could have been predicted. However, the unexpected ones feel like they're random. The truth is that they are not random. Uh, However, they are caused by internal triggers rather than external ones. So that is what makes them seem to come out of nowhere. Like I said, the most devastating part of the of all this isn't the attack itself. It is the fear of having another attack. So what happens is that you go into a vicious cycle. You have an attack, then you fear of having another one. This puts you in a state of hypervigilance, meaning that you're constantly looking for dangers. Because you are hypervigilant, this makes you misinterpret normal sensations as something. For instance, this is an example that I almost always give to people I work with. You think or you get the idea in your head that your heart is beating irregularly. And in order for you to listen to how your heart is beating, you involuntarily hold your breath. Because you're holding your breath, this um, causes your respiration to become irregular, and you hyperventilate, which causes in turn your heart to start beating irregularly. And then you say, aha, you see, I knew there was something wrong with my heart. But that's just a vicious cycle that in this situation you yourself have caused. And this misinterpretation of normal sensations leads to having anxiety about anxiety. And having anxiety about anxiety increases the chances of you having another attack. And this whole vicious cycle is what keeps people trapped for years even. And the key to recovery is learning how to break that cycle. So what's actually happening in your body when a panic attack hits? Your amygdala, which is your brain's fear center, detects a threat and activates your fight or flight system. And this cascades into a whole series of events. So the amygdala sends a signal to the hypothalamus. The hypothalamus sends a signal to the sympathetic nervous system, which in turn sends a signal to your adrenal glands, which in turn release a flood of adrenaline and cortisol in your body. And when that happens, the heart starts to race because it's pumping blood to muscles. The breathing accelerates, meaning that you get more oxygen, meaning that you might start feeling dizzy or lightheaded. The muscles become tense because you are preparing for fight or flight. Digestion stops because energy gets redirected mainly to your extremities, meaning mainly to your limbs, because those are the things that you need in fight or flight. So digestion is the least of your body's concern right then, which is actually what explains why people having panic attacks a lot of times have digestive problems, because their digestion stops working normally. It only kicks in when it has enough room, when the person doesn't have a panic attack or doesn't experience anxiety, which is less and less as the situation progresses. So a lot of people in this condition end up having digestive problems as well. Another thing that happens is that pupils dilate because this enhances your vision and again prepares you for fight or flight. And sweating increases, which is a natural cooling mechanism of the body. And this whole suite of reactions are, in fact, your survival system doing exactly what it's supposed to do. The problem is that it's firing when there's no actual danger present. And because we're talking about the physical symptoms, I want to clarify something that's really important, which is why the panic attack a lot of times feels exactly like a heart attack. And there's a couple of reasons for this, but mainly the explanation is that they share similar symptoms. A common symptom between the panic attack and the heart attack is having chest pains. However, when you are having a panic attack, you are not actually having chest pains. You have severe muscle contraction caused by the adrenaline surge, which contract the muscles of your torso and of your chest. And that makes you mistake that sensation for chest pain. However, it is not chest pain. Another shared symptom is having difficulty breathing, and this is caused in the case of panic attacks by hyperventilation, which causes CO2 imbalance in the bloodstream. Um, Another common symptom is dizziness, like I said, because the blood is redirected to your limbs. Uh, but for this reason, for the reason that the symptoms are similar, 60% of people that are having their first panic attack end up in the ER, in the emergency room, because they are convinced that they are having a panic attack, that they are having a heart attack, excuse me. However, it needs to be said that you should always rule out um, possible cardiac causes, because just just because you think it's a heart attack, that doesn't make it so. But so is the case the other way around. So just because you think it's a panic attack, that doesn't necessarily rule out a heart condition. So you should do that first and check the condition of your heart. And once you do that and you know that your heart is perfectly fine, then you can conclude that it's something to do with panic, and you can address it appropriately. There is a difference to be made here, to be understood, between anxiety and panic. Anxiety is a gradual build-up. It's anticipatory, it has lower intensity, but it's sustained. Panic, on the other hand, has a sudden onset. It peaks within 10 minutes, and it has a very high intensity, but it has a shorter duration. So panic is like your alarm system going off and screaming incessantly, whereas anxiety is a constant low-level hum, like a fan working in the background. You uh, you're not necessarily thrown off by the sound, but it's there nonetheless. It's always there. Now, why do some people get panic attacks while others don't? There is something to be said here about the genetic predisposition, in that 40% is actually heritable, and it comes down to having a slightly more sensitive nervous system. However, why some people are more predisposed to panic attacks has more to do with their personal history than heredity. For instance, people who have experienced chronic stress, or people who have unprocessed trauma, are usually in a state of hypervigilance, which makes them all the more susceptible to having a panic attack at some point. And there is also a case to be made about learned patterns. So uh, even if panic attacks aren't passed down from one generation to another, if you grew up um, seeing someone, usually one of your parents, having panic attacks, having anxiety, and being extremely reactive, you might be more prone to having panic attacks yourself, simply because you have seen the pattern and you have seen the model, not because it was passed down to you from genes, but because you have been exposed to that pattern, and you can, uh, if if needed, and if the circumstances are appropriate, you can defer back to that model. So that's uh, how heredity and learned patterns from family actually interact with each other. Now, what are the real causes of the panic attacks? And I will introduce you now to the three dimensions, and it's what most treatments get wrong, because they only address one dimension, and it's usually either the psychological dimension, which is addressed with therapy, or the physical dimension, which is addressed with medication of some sort. However, panic attacks exist across three dimensions, just like us human beings, and you need to address all three in order to actually resolve them. From a physical point of view, also known as a somatic point of view, your nervous system, when you are experiencing panic attacks, is stuck in survival mode. So your nervous system has three states. The safe and social one, also known as ventral vagal, the fight or flight mode, which is also known as the sympathetic mode, or the shutdown mode, which is known as the dorsal vagal. And when you have panic attacks, your nervous system is stuck in sympathetic activation and it's constantly scanning for threats inside and outside and inside, meaning outside in your environment, in what happens around you, inside with what is happening with your body. Like I said, listening to how your heart's beating or any other number of things um, that you check constantly, and that end up leading to a whole number of health concerns and so on. 80% of the panic that you feel is happening in your body, not in your mind. Trauma and chronic stress get stored physically in your muscles, in your nervous system, in your gut. And this is why you can have a panic attack without experiencing any conscious fear prior to that. It's because your body is responding to its stored material. So, for instance, someone had their first panic attack in a hospital waiting room, even though they went there for a regular checkup and there was no immediate or apparent danger they were in. And that's because their body was still holding the trauma of being there in that same waiting room a few years back when that person had an accident. And uh, in even if years later he found himself in the same waiting room and he was um, consciously just fine about everything, his body reacted to that same circumstance and um, delivered the panic attack, taking him completely by surprise. What are some physical triggers that you need to look out for in order to make sure that you don't make the panic attacks worse? The major trigger is sleep deprivation. So if you don't get enough sleep, you're more likely to get panic attacks. Another one is blood sugar crashes. So you should check your diet and um, uh, you should check for insulin spikes and insulin crashes, caffeine and stimulants, hormonal changes. Now, when I say hormonal changes, I'm mostly referring to hormonal changes that come with the changes in age. For instance, hormonal changes when it comes to entering adolescence, or when a woman experiences pregnancy, or when a woman experiences menopause, that sort of changes. However, they are not the only ones. Another major trigger is dehydration. So dehydration can cause a whole lot of symptoms very similar to panic attacks, like dizziness, um, like heart beating irregularly, like having difficulty breathing, and so on. Now, all of these triggers in and of themselves cannot usually do not have the power to trigger the panic attack. However, they do make your nervous system more reactive and they increase the likelihood of a panic attack happening. To discuss the second dimension, which is the psychological one, from an Adlerian and psychodynamic perspective, panic attacks often signal an unresolved internal conflict. For instance, you hate the job that you have, but you also need the money. So you are faced with an internal conflict between staying and continuing to suffer versus leaving and potentially starving to death. And when you can't resolve this conflict consciously, then your body might take it upon itself to force the issue to be solved with panic attacks. For instance, in my case, my panic attacks at one point have disappeared completely because they had something to do with my corporate job. However, they didn't disappear when I left. They disappeared when I decided to leave. So I didn't even need to wait for the decision to be put in practice. I just needed to resolve the conflict internally, and then the panic stopped altogether. So a lot of times, panic is trying to force a decision that you're either unable or much more likely unwilling to make. Panic attacks often occur when you are suppressing emotions, especially anger, grief, or shame. Now, if you don't allow yourself to feel these emotions for some reason, uh, be it, they might be scary to you, or you were taught that these are bad emotions and you shouldn't feel them, or you just don't have the time for this, for all of this nonsense. When you suppress them, they might come out as panic eventually, and that's your psyche saying, look, you need to pay attention to this because you need to feel and deal with this, and you cannot ignore it indefinitely. Now, most panic is rooted in one of the core fears. If you don't know what the core fears are, they are the fear of dying, the fear of losing control, the fear of going crazy, and the fear of not belonging or of getting rejected. And these core fears are usually formed in childhood, in times where, for some reason, you weren't generally safe, or where your love was when being loved was conditional on you behaving, let's say. So if you weren't a good boy or a good girl, your parent would either reject you or stop loving you. And the panic that you feel now as an adult is your uh, inner child, like we use that notion a lot, is your inner child still trying to protect you. When we deal with the third dimension, which is the spiritual one, uh, panic attacks um, usually have to do with living out of alignment. And this spiritual dimension is the one most therapists completely ignore, but it's often the root cause of what you're feeling. And you might be experiencing something that I like to call spiritual panic. And spiritual panic happens when you're living in violation of your core values. For instance, you're working a job that feels meaningless. You're living someone else's definition of success. You are betraying your integrity for money or for the approval of others. Um, And your body usually rebels when your external life contradicts your internal truth. Another reason for having anxiety is experiencing some sort of existential anxiety. So, when life feels pointless, when you have disconnected from meaning, that's when existential anxiety shows up to fill the void. And this often happens with successful people who have achieved everything they thought they needed, and they still feel empty inside. And the panic shows up at that point to ask, okay, is that it? This is what we have fought for. Is what we have sacrificed for. So what's the point? And if that's what's causing the panic or the anxiety with you, I'm sorry to tell you, but you cannot medicate your way out of this. You have to reconnect with meaning in order to solve this. There is no other way out. Now, uh, what are some things that you should do during a panic attack and things that you shouldn't do? To start with the things that you shouldn't do, you shouldn't tell yourself to just calm down, because that only creates more pressure on yourself. By the way, this also applies to other people. So if you are with someone having a panic attack, never ever tell them to calm down, because it doesn't work, and it just makes things worse. And speaking of making things worse, don't try to fight the feeling, the panic, because you're only going to make it worse. Don't try to think your way out of it, because, like I said, the panic is mostly in the body, it's not in your thoughts. And don't do uh, deep breathing, especially slow deep breathing, if the panic is high. So you doing slow deep breaths when you are at the height of a panic attack episode can actually intensify it. So what might work? What not what might work? What usually works in a panic attack? Um, you could use the something that's called the cold water dive reflex, which is, you can fill a sink with ice cold water, or throw some ice in the water if it's not cool enough. Hold your breath and submerge your face for 10 to 15 seconds. And this triggers the reflex that all mammals have, which is the dive reflex. And when that happens, your body immediately slows down your heart rate. If you don't want to do that, if you don't want to deal with the whole sink and so on, you can put an ice pack on your forehead and cheeks for about 30 seconds, and you should get a very similar effect. Another thing that you can do is to do intense movements. So if your body, like I said earlier, is flooded with adrenaline, you need to flush that out as soon as possible. And how you do that? You do that by intense movements. Jump up and down, do jumping jacks, run in place, shake your entire body, whatever helps in consuming the stress hormones that you have accumulated. Another thing that works is to use strong sensory stimulation, meaning you could hold, for instance, an ice cube in the palm of your hand. You could bite into a lemon. You could smell something that has a really strong smell, and the intense sensations can interrupt the panic circuit, and they can ground you in the present. Another thing that that you can do, and that this one I used to use quite a lot for myself and for the and I used to recommend it a lot for people I work with, is to exhale forcefully. So when you have a panic attack, you should never inhale forcefully, because that causes hyperventilation and a whole bunch of other problems. But you can try to exhale forcefully and let the inhale come naturally. And what this does is that it pushes the CO2 buildup out, and it lets you breathe much, much easier. And another thing that you can do is, if at all possible, because if you're in public, there's probably not a good idea to do this. But if you're at home, you can just um, uh, put yourself in the fetal position, meaning lying on your side, knees pulled towards the chest. However, be careful not to compress your lungs. So don't pull the knees too tightly to your chest. But if you sit yourself in the fetal position, what this does is that it is the safest position that we can be in. It's the position when we are in our mother's womb, and it's also the natural defensive position. So being in this position helps activate the calm response. Like I said, during a panic attack, you shouldn't attempt to resist it, because when you resist it, it usually ends up being longer in duration. Instead, you should say, okay, I'm having a panic attack. I've had them before. They're extremely unpleasant, but they are temporary. So they will pass, and I am safe. I'm not dying. I am here, and I'm going to make it out of this. And you should ride the wave. So, like I said, panic peaks at about the 10-minute mark. Your job isn't to stop it, it's to survive it without doing things to make it worse. And after it passes, you shouldn't try to analyze it immediately. Your body just went through pretty intense experience, and you should allow it time to recuperate. You shouldn't go into analyze mode immediately. There are a few mistakes that a lot of people make when it comes to having panic attacks. And one of those mistakes is to leave the situation immediately. You shouldn't leave the situation immediately, assuming that the situation has caused the episode. For instance, if you are in a crowd, you shouldn't attempt to leave and get to safety immediately, because that is going to reinforce avoidance behavior, and it's going to increase the chances of you avoiding any crowd in the future. What you should do is just do the things that I said prior, and ride the wave and get to the other side and get out of the panic state, and then leave. Another mistake is to call for help every time, because um, because this creates dependency on another person or on a safety behavior. Now, I know how frightening having a panic attack is, so I get the tendency to call someone for help, but in the long term, it does you more harm than good. Another mistake that a lot of people make is using alcohol or other substances to cope. And I'm going to name here specifically the use of marijuana for dealing with anxiety. There are, of course, many people who are using alcohol to deal with anxiety. However, when um, when you say that, look, you shouldn't have a glass of whiskey in order to deal with your anxiety, a lot of people, the majority of people agrees that that's a sound advice and that you shouldn't really do that. However, not so many people agree when you tell them, look, you shouldn't light up a joint whenever you have anxiety. And for that reason, I think that at this present moment, at least, marijuana is more detrimental than actually alcohol, because even people using alcohol to self-medicate aren't under any illusion that it's not really good for them. However, the people using marijuana, not so much. The problem with all of these self-medicating solutions is that they do provide some temporary relief. They do, but they end up making the disorder worse over long term. So you should really um, go through this without relying on a crutch like a substance to help get you through. Now, what are some things that you can do long term uh, to prevent panic attacks and to actually um, uh, help help yourself in becoming less likely to have them? A lot of these things actually are beneficial to you, even if you are not having panic attacks or never had any. However, if you do have panic attacks, you can take this opportunity to make some changes to your lifestyle that are good for you in the long term, panic attacks or not. So the first thing is that the first hour after you wake up, you shouldn't touch your phone under any circumstance, uh, unless there is some sort of dire emergency. But a dire emergency isn't going to show up daily. As soon as you wake up, like I said, no touching the phone. You should get sunlight, at least 10 to 15 minutes, assuming you don't live in a country where you see the sun maybe every 3 months. You should do some gentle movements of some sort of exercise, something like that. Get some cold water on your face, because that activates a whole series of beneficial events and responses. And then eat something, and this sets your nervous system to be balanced throughout the day. What you should be careful with is the use of caffeine, because it can mimic panic symptoms. So you should either eliminate caffeine altogether or at least drastically reduce it. You should make sure that you are getting 8 to 9 hours of sleep per night, and this is non-negotiable, because sleep deprivation is the number one trigger for panic attacks. And you should watch your blood sugar. This means eating regular meals, balancing the food groups, and avoiding sugar crashes. And you should do 30 to 60 minutes of exercise daily, particular aerobic exercise, meaning no weightlifting. You can do weightlifting, of course, but you should also incorporate aerobic exercise, meaning running, swimming, riding a bike, things like that. This isn't optional if you have panic attacks. It's actually medicine, doing the exercises daily, I mean. Other things that you can do are somatic release practices like progressive muscle relaxation, dancing, and anything that helps move energy through your body. Um, and like I said, remember that 80% of panic is stored physically, so you need some sort of physical release. Now, when it comes to treatment options, um, medication is, of course, at the forefront of uh, treatments prescribed and so on. Now, my stance on this is that medication can be a bridge while you build other skills to help you function somewhat normal. But medication doesn't solve the panic long term. And research shows that therapy and medication work better than either alone. When it comes to therapy approaches, there are a set of approaches that work. The first one being CBT, cognitive behavioral therapy. What it does is that it restructures catastrophic thoughts and it builds gradual exposure to feared situations. 70 to 80% who go through it show improvement. However, the limitation CBT has is that it often provides symptom management, not root resolution. And it focuses on thoughts and behaviors, of course, given the name cognitive behavioral, and it does so while neglecting body and spirit. Another option is psychodynamic or Adlerian therapy. What this does is that it explores unconscious conflicts, it helps process unresolved emotions, and it addresses root psychological causes. 73 to 83% are panic free after treatment, and the results hold long term. This is best for people who want to resolve panic completely, not just help managing the symptoms. Another option is somatic therapy. This works to release trauma stored in the body and to regulate nervous system through physical interventions. It's best for trauma-based panic and people with severe physical symptoms. Another option is EMDR. What this does is that it processes traumatic memories through bilateral stimulation. And it's based for panic rooted in specific traumatic events. Another option is the alignment method. This is my approach, and it's a 12-week intensive that addresses all three dimensions simultaneously. Now, it is to be said that the alignment method was I have originally developed it to work on anxiety and panic attacks specifically, but uh, since then it has evolved tremendously, and it is um, these are not its main focus anymore. However, it still stands as a valid approach in treating these disorders. And what the alignment method does on a physical level, it works with somatic release and nervous system regulation. On a psychological level, it addresses unconscious patterns and internal conflicts. And on a spiritual level, it works on values alignment and meaning making. And 85% of clients who complete it experience lasting transformation. When should you seek professional help? There are some red flags that indicate that you need to get immediate help. And these are having multiple panic attacks per week, having um, starting to avoid important life activities. Now, for instance, I had a client who at one point stopped going to pick up his son from school because he was getting extreme panic attacks the moment he saw the moment he saw the school building, and that he didn't stop picking up his son because he didn't have the time or he didn't want to. He stopped because of the panic attacks, and uh, that's one cue that you should get professional help immediately. Some other cues are using substances to cope, whatever the substance is, because it might um, um, first of all, it's not going to solve the panic. Second of all, it's going to evolve more, most likely, into you getting addicted to that substance. And third, you getting addicted to that substance poses um, uh, serious health risks to you. Another red flag is, of course, having suicidal thoughts. If you are having suicidal thoughts, you should call for help immediately. Or another red flag is being unable to work or to maintain relationships because you are experiencing panic attacks. If any of these apply, you shouldn't wait and you should reach out to a professional immediately. When you do reach out, what should you look for in a therapist? I think that you should check to see if they are trained in an evidence-based approach like CBT, psychodynamic, somatic, EMDR. Uh, you should check that they understand trauma and nervous system regulation, and you should check, if that's important to you, that the therapist is willing to address the spiritual dimension as well. So the point is that um, the the point I want to make is that if you find someone who is qualified, keep in mind that in the end, the relationship, the therapeutic relationship, matters more than the modality specifically. So if you find someone who is qualified and you can, at the same time they are someone that you can trust, that's probably a valid choice for a therapist. Okay, so this brings us a little bit closer to the finish line. However, I want to take a moment to reiterate some conclusions, because I think that we should take the time to really sit with some ideas, not just go through them uh, really fast and 5 minutes later forget all about it. So, what are some key takeaways that I really would like you to remember from this video? Uh, the first is that panic attacks are not a life sentence. They're the alarm for your nervous system, and like any alarm, this can be regulated. It can be fine-tuned. Uh, Panic attacks are not random. They're information. It's your body trying to tell you something. And the best thing that you can do is to start to listen. Panic attacks exist and appear in all three dimensions. In the physical dimension, they appear as nervous system dysregulation. In the psychological dimension, they appear as internal conflict or suppressed emotions. And in the spiritual dimension, they appear as misalignment with values and meaning. During an attack, the best things that you can do is have some cold water on your body, move, move your body, exhale forcefully, and don't attempt to fight it in any way. And long term, you should address all three dimensions because partial approaches give partial results. So if you're watching this and you're struggling with panic attacks, you have my sympathy. I've been there, so I know what you're going through, but I want you to know that you're not broken, you're not weak, you're not going crazy. Uh, they are terrifying, that's true, but they can also be transformative when you understand what they're trying to communicate. I've watched hundreds of people move from daily panic attacks to complete freedom, myself included. I haven't had a panic attack in over 15 years now. And you can be next. But you don't do that by managing symptoms forever. You do that by addressing the root causes. Now, if this was helpful, please like and subscribe and consider sharing the video as well, because it helps reach more people and it helps in increases the chances of reaching the right people that the information can help. If you want, you can take my free overwhelm assessment at therapymatters.com. You can find the link in the description. This identifies your level of stress and overwhelm and your next steps. You can check the description below for timestamps, more resources and links. And you can also leave a comment. Now, like, what's one insight that you're taking away from all of this? Or what's one question that popped in your mind and maybe I haven't answered or I haven't answered fully? I read all comments and try to respond as soon as possible. The uh, the thing I want you to know is that you don't have to do this alone and that help is available. Thank you for watching, and I hope I see you on the next one. Bye.